You good?
Your life.
All righty. Hi, everybody. It's Dr. David. Welcome to our monthly Ask Dr. David live YouTube special that we have now done several times. Thank you so much for watching. I know that this has been an exciting thing for me to be able to answer questions a little more extemporaneously and to hear from all types of people and all types of questions. I hope that you're getting something out of it too. And of course, please share what you learn with us and to share this video as well because we'll be posting it afterwards as well as some of the selected questions. But thank you for your support. It's really very appreciative. Um, if you haven't already, though, please do subscribe to our YouTube channel where you can get all of the greatest things that I come up with in my brain, some of the and etc. to be able to share with you. Joining us off camera is our executive producer Shari Kulanu. So hi Shari, thank you for setting this up and sending me the questions as they come in. Um, we always do start off with questions if we get any from our Patreon subscriber on Patreon, our members there, as well as subscribers to our YouTube channel. So of course, if you want to be bumped up for future questions, please join us on those media sites. Okay. Now, of course, I do want to put a disclaimer. Everything that we're going to be talking about here today is for general knowledge. And everybody's different. People have different metabolisms, allergies, all types of things. So what a general answer may not be what's right for the personal individual. But of course, as somebody who looks at every case individually, that's why, of course, we find it's important to seek medical advice, hopefully with a provider such as ourselves or in our office here, who can at least get you the information that you are looking for and who will respect you for the different choices and options that you make and respect your individuality. Okay, so first question here. So, what is your opinion on B12 shots, safety and efficacy? Do you recommend oral drops or monthly B12 shots for someone who has a low level of B12 and experience post COVID fatigue? Also, wondering if it's possible to overdose and take too much orally. Okay, B12. Now, that's something that I've certainly talked a lot about through the years. So, first of all, we have to clarify something. A B12 shot is like kind of like saying a shot of alcohol. Okay, in that there's obviously different types of alcohols that people can consume. Although, of course, a shot of alcohol would kind of work the same way. But the typical so cobalamin is vitamin B12, and the most common form that's in a supplement is called cyanocobalamin, a version that then needs to be turned into other forms. So before we start talking about actually the way of taking it, I think it's important for us to spend a couple of minutes understanding what that means. Okay. So B12, and you've heard us talk probably more about anything about a form called methyl B12. Now, methyl B12 is vitamin B12 that has a methyl group on it, which is basically a carbon, not basically, it is a carbon with a couple of hydrogens that are hanging off the side. That is what a methyl group is. Now, to know what is the best form of, but I should say, there's also a form called adenosyl cobalamin. There is hydroxycobalamin. So one of the important things to know is which forms, if can your body absorb if you're taking it orally, but also which forms can your body convert one into. Okay, so I've talked before about MTHFR in our long conversation that we had with Dr. Lynch a few months back about how MTHFR's job is to take folate, methylate it into methylfolate. Now, there are similar enzymes that work on the B12, MTRR and MTR. And so, if a person has a mutation that it makes it that those enzymes will not work as functionally well, then that person may specifically need to be taking methyl B12. But there are other enzymes that are responsible for making adeno B12. And then the question is, what if a person gets over methylated? Sometimes people will have a negative reaction if they get too many methylated B vitamins. Hydroxy B12 might be the right answer for that person. So we run a genetic test in our office called the Max Function Test by a company called Maximize Genetics. There are other companies who do this as well. This just happens to be my favorite. I find it the most user friendly. And that can really tell me what versions of this a person needs in the first place. Okay, some people, there's another enzyme that you look at that it tells you, hey, you're not going to absorb it very well at all. And again, in that person, they may do better doing it in an injected form off in the first place. Now, I have been using methyl B12. That is the most common form by far that I have been using in my practice, and I've been doing this. God, it's been over 20 years. It's back about 1999, 2000 when I started using methyl B12, and this was something that came to us in the autism community. Biomedical autism has always been the canary in the coal mine, if you will. Things that we learned first in the autism populations, we then expanded out to other populations who have chronic issues and find that usually it's not something specific to autism. So we started giving methyl B12 injections based upon the initial work of Dr. Jim Newbrander, a dear friend of ours in the movement, who did something very interesting back in the day. Because when a family would come in for him with autism to see their child on autism, with autism, I should say, he would give them a questionnaire, have them only do methyl B12 for 3 months, and then have them repeat the questionnaire in order for them to change to see what changes were there. And what he found was 90% of the kids showed some level of improvement in some form of their autism, and found that the most common thing was improvements in communication, which of course is huge for most people on the autism spectrum. So this is something that we typically give at a dose of 75 micrograms per kilogram. It has to be made in a 25 milligram per ml solution. It needs to be super concentrated. A lot of pharmacies can't do that. So it has to be an experienced compounding pharmacy who can do this. And then it's typically given every third day as a subcutaneous injection, which means underneath the skin. And you aim for the fatty. So we have actually a layer of skin. There's a fatty layer and then there's a muscle. And so you're trying to get it into that space in between. So if you go straight down, you can actually go into the muscle. So what we tell people to do is kind of like the angle of an airplane coming in for a landing, like a 30-degree angle, and that gets it into that fatty tissue where it then slowly releases into the bloodstream over the next 3 days, and it becomes an extended release version. If it hits the muscle, it all goes into the bloodstream pretty quickly. So that's also really important. There are some people who need it more often. I tell them if the first 2 days are good, but then it wears off, maybe you need it every other day. Some people only need it once a week. Some people tell me, hey, man, the first day or two, my kid's hyperactive, then settles down nicely. They may need it less often. So that's part of the conversation in the first place. Now, in the methyl B12 form, oral can be done not swallowed. The reason why it was done injected in the first place is because it seems as if when you swallow methyl B12, it will be demethylated in the gut and then get into the bloodstream as the demethylated form, so kind of counteracting what you were trying to accomplish. So we have used nasal spray forms in the past, but there's also like a drop that you can put on your fingers, like 1,000 units per drop. So it's very concentrated. Just like rub in the mouth on the inside of the cheek. You wait about 10 minutes. It can be orally absorbed and therefore not going through the gut. So that's kind of a way that we accomplish that. Now, in terms of so in terms of low levels for energy, I kind of would play the energy consideration as to how a person feels with it and how long it lasts in order to determine. Okay. And of course, if the oral form is working and you don't have to give a shot or take a shot, that's great. Now, in terms of overdosing, it does have somewhat of a half life. That's how long it takes to clear the body, and and it can store in the liver some. Now, it doesn't store the way that fat soluble vitamins. Those are E, D, A, K, or we call it the ADEC. Actually, I put the letters in the wrong order there, but it does stick around. But you don't really hear about anybody overdosing on it. Now, certainly, I have seen people who take too much of any B vitamins, but including this, if they take too much, they can get kind of irritable or hyped up. B vitamins tend to give people energy. And so that is, just something to work for if you're over energized. If you've got the energizer buddy going there, then that may be a sign that you're doing too much. You didn't hurt the person, but maybe, sometimes we have to do less than 75 micrograms per ml. Now, the next question. Oh, so I hope that helps. Okay, next question. Are carnitine supplements safe to take on a daily basis for someone whose levels are on the very low end of range, high 20s? Okay. How much is okay to be taken to bring the levels up? And is it true that acetylcarnitine is the preferred supplement form? Okay. So, first of all, yes, if a person has low carnitine levels, it's fine to take it long term, just like if you had any kind of a low iron level, you need to take it long term. Now, granted, you may get it from food or a supplement, but you need to take it long term if your body isn't maintaining it. So yes, I have had people on carnitine for a very, very long time. Okay, there are genetic conditions, mitochondrial issues where a person must be taking it. Now, there are two different forms of carnitine. One that's called L-carnitine, and one that is called adenylyl. I'm sorry, acetylcarnitine. Now, acetyl-L-carnitine seems to be a form that crosses into the brain more. So if we're talking about mental or neurological health, behavioral health, and it's low, I will typically use acetyl-L-carnitine to get better brain penetration, whereas the regular carnitine, L-carnitine, that is more for muscle and strength. So it's something even you'll see bodybuilders and athletes use as one of the safe thing supplements that a person can take. Okay. Now it depends on a person's body weight, but there, the dosing can really vary very much so, from anywhere from 25 milligrams to kilo on up. So I always start on the lower side. I find that most of my patients are typically going to start off somewhere in the 250 to 500 milligram range. But I check blood levels. Now, this question about high 20s being the low end of range, that to me is actually low. And most of the laboratories that I've seen list 30 or 32, around 34 as the cutoff. I try to get people in the mid 40s when they're low. That's kind of a rule of thumb for me. I always try to get the levels in the middle part of range. So you'll see ranges 30 to 60. So mid 40s kind of seems about right, for what I'm aiming for. But of course, if it's up, you can bring it up and you can stop it and you can see if the levels go down. But I like to test. I like to have data. That way, I'm not playing any guessing games. If I've overshot the person, I'll bring the level down, and that's okay. Now, there is also something interesting of note. There is a condition that some people get where they consume carnitine, where they can get like a fishy body smell, and it's a genetic condition, but it is completely harmless. But I have had people have to stop using it because it can be an offensive odor. But you didn't hurt the person with it. It's just one of those things. Um, Now, okay, and is it true that it's so again, okay, I got that. So that's what you my take on carnitine. Okay, so the next question. Do you have a preference between CBG and CBD for anxiety and mood? Is one safer than the other in terms of long term use, especially for teens? And what would be a safe dose for teens struggling with anxiety and depression? Okay, great. So, CBG, so let's take a little step back. CBG is the first active cannabinoid made by the cannabis plant. It then goes on and gets converted into either THC or to CBD. But these are all different chemicals, they all have different biological properties. Okay. Now, CBD has been something that we have studied rather extensively for a couple of decades now. So I feel very comfortable with that. Now, I use CBG in my practice a lot, but there really has not been the same level of studies at all done. Do I have any concerns about it? No, I don't really have any concerns about any of the, especially hemp derived cannabinoids that don't have intoxicating properties. I really don't have any concerns about any of them. I've been using them for a while and they certainly do appear to be very safe. But obviously, we don't know what 50 years of use is because we haven't done this for 50 years. So, how could we possibly know? Now, what I typically do though, and anxiety mood, I kind of put those things into the same box. I always, whenever I'm doing any form of cannabinoid, I really want to do CBD first. The issue is that most people don't know how much to take, and I typically work to about 50 milligrams a dose, 2, 3 times a day. And if I don't see an improvement with that, and I'm still dealing with anxiety, then I'll tend to bring in the CBG and kind of work up to probably closer to 25 milligrams per dose. But I'll tell people to take them both at the same time because they can have a synergistic effect. Um, so that answers the dosing question. Yeah. Okay. So yeah, that's my take on it. Now there's certainly lots of other cannabinoids that I'm sure we'll get into as time goes on this show. Been talking about things like CBGA. Well, let's talk about that for just a second because CBGA is actually gets converted into CBG. So whenever you hear an A, you'll hear THCA, CBDA. That is the acid form of the cannabinoid, and it's typically then gets converted often through heating in the case of THCA to THC. So when a person eats if a person were to consume juice, etc., raw cannabis, they don't get high. because it needs to be heated, activated, and then it goes from THCA to THC, 9 delta THC in particular, and that's what causes the more euphoric effect of it. But people who juice it, eat it raw, they shouldn't have that type of effect, even though a lot of the other benefits are there. So CBGA actually is what gets converted to CBG then down the line. So, but CBGA, I very much have been liking of recent because of the new research that came out that shows that CBGA seems to be the most anti-inflammatory of all of the cannabinoids that are out there. So especially for people dealing with arthritic and other hyperinflammatory autoimmune conditions, asthma, allergies, eczema, all of those, that the a CBGA could be one of the better options for them. Now, is NAC, which is N-acetylcysteine, actually, hold on a second. Okay, so is NAC, which is N-acetylcysteine, safe for long-term inflammation, or does it need to be stopped after a certain period of time, as in the case of quercetin after 3 months of usage? Now, I'm actually going to take comment on that first thing because actually I looked this up this afternoon because I had never seen anything that said you can't take quercetin long term. I did not find anything that says you can't take quercetin long term. Okay. What I've seen is that there's been research that has studied it up to 12 weeks and it's considered generally safe at 12 weeks. It just hasn't been looked at past then. But I've had people, especially as some people know, I've been using quercetin, especially an ingredient called phytosome, which helps drive zinc into cells and therefore can increase intracellular zinc levels, which we do find very helpful for fighting off viruses. But I've had people who have been taking quercetin pretty much since the first couple of months of COVID nonstop. But again, if people have low red blood cell zinc levels and I give it and it works, I'll stay in it long term. So that's that. By all means, if whoever submitted this question does have any data or otherwise that says that I've overlooked something, please share it with me because, of course, not only do I want to correct the record, but I don't know everything and I'm always learning. And I find that I learn more from my patients than I do any other source. So please, if you have something on that, share it with me. Now, back to your original question, which is about N-acetylcysteine. So let's say, what is that in the first place? Okay, so N-acetylcysteine is a modified amino acid. It is itself a detoxifier. In fact, if a person were to have a Tylenol overdose, you give it to somebody in high doses in the emergency room. So this is something that every medical student, if you've been through the emergency room, you know about N-acetylcysteine because it's used for that. The product is called Mucomist. It's also can be given I'm sorry, the mucomist is actually can be an inhaled form because it's also something that can be used very successfully in cystic fibrosis. These are mainstream treatments. This is not in the holistic world. This has been something that I learned about back in my residency back in the 90s, so a long time now. So N-acetylcysteine, though, another thing about it, it is the rate limiting step and the most important amino acid in this triad. There's three amino acids that make up glutathione. Glutathione is the body's most important detoxifier, antioxidant, and helps remove inflammation. Super important. Now, N-acetylcysteine is something that we can check. You can do a blood test on it, but it's also a marker found on our urine organic acid test. This OAT test, as we call it, is a common thing that we look at, especially when people have chronic issues. Looks at a whole bunch of other markers, yeast markers, bacteria markers, but you can get an N-acetylcysteine level on it. And I will sometimes see people see levels of 0. And so giving N-acetylcysteine is the treatment. Now, what form? Let's talk about that for a second. Now, there are capsule forms on it, but there is a particular product that was studied at Stanford. This is probably going back into 2005-ish, I'm going to guess, called Pharmanac. And were looking specifically at people with autism. And they had found that when they used this particular product, it's like an effervescent tablet, not as Alka-Seltzer, but kind of like maybe Moscato-y in the way it comes out. Um, but it's a tablet, you put it into water. It's kind of like a pomegranate berry kind of flavor to it. And this particular product, they had shown when they compared it to people before versus after with autism. Now, not every single person showed an advantage in every single symptom, but compared to baseline, every single symptom of autism that they studied in the group showed a statistically significant improvement relative to the baseline. So that was pretty cool. And whenever there is a product that's been studied at a university level, that would always be a preference for me because again, it's been looked at with an institutional review board study better than hey, my friend took it. Okay. So of course, getting that kind of product, but there are other products. There are oral products, 600 to 900 milligrams, 2 to 3 times a day is typically what people do. But yes, it is safe to use long term. Again, I've had people on this for more than a decade. Haven't seen any reason why it wouldn't be. But again, it's just a precursor for these other for the glutathione and useful in the body itself, and it should be there. Okay. Next question. Okay. I have a family history of high cholesterol and heart disease. I do not want to be on statins, but I have struggled to lower my cholesterol. A year ago, my level was 213. I've been eating healthier. This year, it came back up to 203. My good cholesterol was only 37, which is the highest it's ever been, which it really should be at least 40, 45, 50. I eat healthy and intermittent fast, take fish oils and psyllium, and exercise regularly. What can I do? I can't seem to raise my HDL or significantly lower my LDL. I'm considering a pescatarian diet. Any suggestions? Okay. I'm glad that you mentioned the intermittent fasting. I do think that that is something that does help people metabolism. For those people who don't know, intermittent fasting is where on a daily basis you eat during only a certain window. This is something that I choose to do. I eat over an 8 hour period and then I fast for the 16 hours. So I will drink some unsweetened coffee in the morning, which is allowable because it's still a fast. It won't break your blood sugar levels or bring it up. It is something that I have found to be helpful for my overall metabolism as well as my energy levels. Um, Mentioning in terms of a pescatarian. Now, let's talk about actually a plant-based diet. Okay, this is also something, and these are things that I've used, and my cholesterol levels have actually improved doing this. A plant-based diet does not necessarily mean a person being vegan 100% of the time, although that certainly is a plant-based diet. But a plant-based diet is where at least 85% of your meals are not do not contain animal protein or animal substances. Animal substances tend to drive more inflammation. And of course, cholesterol only comes from animal sources. So, kind of, you're really cutting off the cholesterol intake at the pass if you're avoiding all forms of animal products from that perspective. I do choose to eat salmon 3 times a week. That's 2 to 3 times a week. That's kind of where I'm getting that from. And I get my nice omegas from that as well, of course. But let's talk a little bit more here because, first of all, not all people with and 200, 213, that's still considered pretty low. It's not, I mean, it's not low for normal, but it's not like a 300, 400 like we'll sometimes see. Okay. Now, but there's a lot more than just calcium, than just cholesterol. And one of the things that I learned from my friend Lee, cardiologist, my integrative cardiologist, Dr. Jessel Popat. So giving him a shout out if you've ever heard me talk about a cardiologist, he's like a lot of my adult patients. Love the guy, giving me great advice. He taught me about something called a cardiac calcium score, and it's a CAT scan that is done with an injection that lights up calcium in the body. Now, whenever there is inflammation, there is calcium. So the cholesterol in the bloodstream is not in and of itself the problem. The cholesterol can lead to calcifications and plaque buildup, and that causes the blockage. So there are people who have higher cholesterol levels, but who have a cardiac calcium score of 0. Now, I was very fortunate when I did mine. Mine is a 0. He said, "Hey, you're in your 50s already. We see what your cholesterol is doing. Say what you're doing. You're never gonna have a problem with your cardiac. You'll live past 100 with your heart." Other things, who knows what get me, but at least I know my cardiac situation is quite wonderful. But that is the really important thing, is it building up there? And usually if it's building up in the heart, it's also building up in the carotid arteries. People can also do an additional step of an ultrasound of the heart called an echocardiogram, or an ultrasound of the carotid arteries to see if there's any buildup. Now, if there is buildup, that's where the concern needs to come into play. And in all honesty, that is where I think taking a statin is much more relevant than if there's no buildup. So, so certainly everything is significant, but if somebody has a high calcium cardiac score, that is a concern. That is the person who's going to be at higher risk of having a sudden cardiac issue, and that's obviously a bad thing to have happen. So that's one of the things that I would be looking to in order to really, really assess if there is more of an issue or not. Um, of course, taking fish oil, the psyllium, other things that you said. So you're doing a lot of right things there, but that may be some additional things that can help you kind of get to the optimal health where you want to be. And of course, working with a doctor who knows what they're doing in terms of this. Something I do want to quickly say about people who take statins. One of the bigger concerns about statins is that it can deplete CoQ10 levels. We can check a CoQ10 level. In fact, going back to the carnitine conversation, you need CoQ10 in order for carnitine to actually work properly. But CoQ10 in of itself is cardioprotective, and you want to see the level around 2 in the bloodstream. Even though they say like, normal is above, I think above zero point 0.3, zero point 0.4. But the cardioprotective level is about 2. So that's of course something that would be very helpful if a person did have to take statins because they can be preventing themselves. And I actually had even gone to a lecture the cardiologist was given, and I wanted to hear what they were saying because they were talking some new things about statins and stuff. I'm like, hey, let me go. It was a free dinner at Capitol Grill also, so hey, why would I want to turn that down? But don't do that too often. But I really wanted to hear what the doctor had to say. And this, I mean, it was a shill. He was a total shill for the drug company. Greatest thing, everybody should be on statins. Maybe you should put your baby on it. Joking about that part. And so I raised my hand after when he was done. I said, I hear you're talking about all these, everybody should be on statins. I didn't hear you make any mention whatsoever about taking CoQ10. Um, my understanding is that statins deplete CoQ10. And he said, "Oh yeah, that's right. In fact, I take CoQ10 100 milligrams every day to counteract it for my statins." And then I said, which of course that kind of both brought giggles in the crowd, and I thought a sheepish look from this guy. Why didn't you tell everybody that? Do you say this at all of your lectures? This is obviously important if you're doing it for yourself. Don't you think it would be a good idea to maybe inform the people who you're putting the statin that you're telling take statins to? Tell us doctors this type of thing. Maybe you should rethink the way you give your you should give your presentations because I really appreciate you sharing that information with me. And of course, everybody came up with me after and said, "Thank you for asking that question." And like I didn't get much eye contact from him the rest of the time. But hey, you know me, I'm gonna call it out when I see it. All righty. Now, next question. What is the best a way to approach eliminating OCD behaviors in my autistic daughter? She's 20, has been having these behaviors in the last year. Behaviors are escalating, becoming more ritualistic. I try to intervene and redirect her. Um, I'm not going to read this whole thing because she gave some examples. She can get very frustrated if we try to block what she's doing. This is just one of the. Okay. She does get ABA therapy at school, but this does not seem to help the behaviors. There was a time I'm not gonna go. Okay, just talked about a couple of those CDs. Okay, well, first of all, in an individual such as this, I would wonder to know if anything happened around the time that these OCDs. Did they take antibiotics, any medications, anything, change in diet, anything that may have potentially exacerbated this situation? Okay, now in my practice, when I see a patient who presents this way, I'm doing two things at the first appointment. Number one, I talk about treatments that have the potential to lower because OCDs run in the same circles as anxiety and depression, kind of on that serotonin, dopamine area. And so I'm looking at things that kind of can help bring that under control. I talk about L-theanine, which is an amino acid made from green tea that bumps the serotonin and the dopamine levels. It also blocks glutamate, which irritates the brain. That can sometimes be helpful. Sometimes I'll add 5-HTP, which is 5-hydroxytryptophan, which is the precursor to serotonin. So I kind of look at the theanine as the construction worker and then the bricks of the 5-HTP, and that can potentially help. I'll also start looking especially at the non-THC cannabinoids, starting off with the CBD, potentially bringing in the CBG, CBGA, etc., like that. That's kind of like how my first fishing net when it comes to treatments. But then for me, it really comes down to our typical biomedical workup, the gut-brain connection. How are the levels of the good bacteria, flora that's supposed to be there? Are there any pathogens like yeast, bacteria, parasites that shouldn't be there? Okay. And we do stool testing, we do urine testing to look for that. We look at things like vitamin D levels. We know importance of vitamin D needs in order for serotonin to hit the receptor and to get it to work. Vitamin D needs to be there, and that's why people who get seasonal depression in the wintertime because they're not getting vitamin D from the sun unless they're taking it as a supplement. So, vitamin D levels, my old standby is looking at zinc and iron levels because I want to check that on everybody. Looking at the good health. Sometimes there could be mitochondrial issues. And so coming back to our CoQ10 and our carnitine levels, that could be helpful. Then I also want to look at their B vitamin metabolism and coming back to the methylation pathways that we were talking about before, the MTHFRs, the MTRRs, MTRs, CBSs, all of these tell us much more about B vitamin metabolism. And that's certainly one of the places where I start. Now, one of the things that's getting much more attention, though, in this OCD, anxiety, depression world is the role of inflammation. Okay. So taking a look at more of like what, maybe there are some neuroprotective, neuroinflammatory things like protective bioflavonoids that could be helpful. Um, could there be any heavy metals there? So it's, not too dissimilar to the workup that I would do for a person with autism anyways, but my treatments may be a little different. If I'm working with a kid with autism or an adult with autism whose primary issue is communication, I have other therapies that I would potentially be using for that. But that's really the kind of the way that I would approach it. But you also did mention ABA, but you didn't mention any other type of therapy. And there are like cognitive behavioral therapy. That is a particular form that it needs to be done by a very, very well trained mental health therapist, that can be very helpful just in terms of it's a kind of like a deprogramming type of thing. And I think that that could be helpful. One of the things that, and I'm going to get more into this as time goes on and more research comes up, but I'm very, very fascinated at people who are at where the role of psychedelics are going to come. You probably have started to hear about people using small doses of psilocybin, and other types of and people taking it one time doing intensive therapies, and it's helping people with PTSD and anxiety and depression, mostly pharmaceutical resistant forms. And so again, with OCD, I would be interested to see if we start seeing stuff coming out with that. Now, this is obviously very not ready for prime time. You cannot get them legally anywhere, I believe, except for Colorado. There may be another place where it's illegally done. Certainly not available here in Florida, but do kind of keep your ear open for this because I think that we are going to see in the next decade, hopefully sooner, a lot more research coming out. It is coming out fast. And so, and will I do believe that a pharmaceutical company will take the active ingredient and proprietize it and encapsulate it and to make it into a standardized dose, which is great. I've actually seen some smaller startup companies. There's actually a company that I was just hearing about called Small Pharma. They chose that name to kind of combat big pharma. So I thought that was kind of cool that they were giving a little dig right there. But that's actually in the process of starting to go through phase 1 trials. I think they actually are in phase 1 and are developing phase 2 now. So be on the lookout for that because I think that that could be something very interesting coming up. Okay, next. My son has expressive and receptive language disorder problems and auditory processing disorders. Can a SPEC scan be used to figure out what kind of therapies can benefit him? What are the benefits of getting a SPEC scan, if any? Okay, let's first talk about what a SPEC scan is. SPEC stands for single photon emission computed tomography. Computed tomography is CT. So it's kind of a form of CT. What this is doing is this does look specifically at brain function and blood flow. Okay. Now, I am definitely not a radiologist. I definitely am not well versed enough to say what the right thing to do if there is an abnormal SPEC scan. Now, most of my knowledge about this is from the fabulous work done by Dr. Daniel Amen, and he has the Amen clinics. His primary office is in Atlanta, I believe, but I believe he has a dozen or so offices throughout the country now, where he takes a very biomedical, holistic approach. But he has found that depending on certain findings of what the finding is and where in the brain it is, he can both determine both pharmaceutical as well as nutritional, nutraceutical types of treatments specific for that. So I think it's really fascinating. I had the wonderful opportunity of sharing a stage with him at a MAPS conference probably about 10 years ago now. And he and I had a chance to talk for a long time afterwards. And, he was very gracious with his time. And, I always want to try and absorb as much information as possible. But really, that would be the clinic that if somebody did want to pursue it, that I would be looking at. It could be very fascinating. But yeah, I just don't know enough about it. And, sometimes a little knowledge can get you dangerous. So I won't dabble in this type of thing. But one of the interesting things that he showed in part of the presentation, he showed typical brains. He showed the brains of people with autism. Then he showed the brains of NFL football players who have the head trauma, the chronic head trauma, even if they didn't get a concussion. When you're running really fast, you stop really fast, your brain hits the front of your skull. It comes this way, that way. So you can even be getting brain damage just from getting a hit, not in the head, from that rapid deceleration of speed. He showed us that the brains of the NFL players and the brains of the people with autism were strikingly similar and were the most affected brains that he had seen. So I don't know what you're going to do with that information, but I thought that was very important to see. We know that a lot of I know that his work really has made it into the understanding of them of medicine within the NFL and with football. Obviously, why we're focusing so much more on closed head injuries and concussion protocols, teaching kids now how to tackle that doesn't at least use your brain, although that deceleration can still happen without. But it is really quite fascinating. But if you go, I think it's amenclinic.com. But if you Google it, you'll see a lot of information there. And if it's something pursuing, I would say give their office a shout out. Tell them we say hi. Okay, next. Okay, so my son Daniel was diagnosed with high functioning autism. By the way, Daniel's your patient, and of course, I know who you are. If you're watching, hi, hello, hi, Daniel. It's good to hear about you. Been hearing through the years of like great things that you've been doing. Um, I know that you've graduated, and and it's mentioned here that you're trying to find a job in the video TV production field, but it's a very difficult journey for him. He sends resumes, he follows up on word of mouth opportunities, but it's really difficult. Is there any organization, program, etc., that you could recommend that we go to? Okay, well, I do have a couple of ideas here. Number one, I would, the Card Center, and every region in Florida, the major universities here it's at USF. There's one at University of Miami, one at University of Central Florida. The Card Center, which is the Center for Autism and Related Disorders, is a wealth of information, referral sources. They're usually pretty well connected within the community. They do work within the university systems as well, so opportunities within the university system could be there as well. So they might know something. Now, also, you know, um, people who are on the spectrum have access to special services sponsored by the state, such as vocational rehab. Now, vocational rehab is very much involved not just in job training, but helping people who have special needs getting jobs, finding placement for them, getting on the job training that a lot of individuals can actually move into a job from that training system. So that might be assist as well. Another thing that I would though consider, I know you mentioned in terms of word of mouth, but one of the things that we have certainly seen through the years in our autism communities is we got each other's back and we try to help each other out and we realize what each other's going through and we try to be there as a community. So if you haven't posted to maybe some of the regional community autism boards, Facebooks, etc., like that, somebody just may know somebody who may know somebody who is willing to take on that because they will have an understanding of what you're going through and be sympathetic to that. So hopefully that points you in some directions there for Daniel, and of course I hope it does. And please keep in touch and let us know how that is going. All right. Next thing. Um, okay. Hello, Dr. David. Hopefully, a future mom here. My most convenient appliances, not applause. Hey, you want applause? Great. You could just everybody would stop and do that. Just kidding. My most convenient appliances, rice cookers, and let me just start that over here. Hello, Dr. David. Hopeful future mom here. My most convenient appliances, rice cooker and air fryer, are made from a form of Teflon. How important is it to avoid cooking with Teflon and aluminum foil? I am not a fan of Teflon whatsoever. I am much more a fan of stainless steel. The if it's something now is if the sides are made of Teflon, it's not as much of a concern. Is the rack made out of Teflon? And maybe there are racks in those situations that you can use that are stainless steel because it really seems to be coming more in contact and absorbing it into the food than more of an air type of thing. So there are other more green versions of these appliances, and certainly that aluminum foil. I wouldn't be wrapping food in aluminum foil and cooking with it. If it's a cold food and you're wrapping it for storage, less of a concern because it would be the heat that would be more concerning for it. Um, at the same time, the there are new products that are coming out. So one of the things that I use a lot in our household are silicon pads, baking pads. We have ones that are the size for our toaster oven, one that are size for the oven that can go like on a baking sheet. And that's something that becomes a nonstick surface. It cooks very nicely there. And that's something that you could be using because it's just silicon and that's pretty darn safe. Okay, so next question. Okay, next question. Do you recommend a specific CBD or CBG ratio if you use in a combination, and what dosages do you recommend for sleep? Okay. So first of all, I am not a big fan of ratio cannabinoid products, period. Simply because if you purchase a product that has both ingredients in it already, you cannot adjust one without adjusting the other. What if you buy a 1-to-1, but it turns out you need a 2-to-1 ratio? You will never be able to get there with that. So I always recommend getting two different products and find out what the best ratio is for the person. I always work up CBD first, then bring the CBG in. Now, if it turns out that a 1-to-1 ratio works and you want to just buy one product instead of two, sure, go for it. But you'll be very limited with those ratios. And that's true amongst that. Now, the question then becomes, what dose do you recommend for sleep? Now, while I use CBD for sleep, I use CBN much more than I do than CBG when it comes for sleep. I've had amazingly wonderful success with it myself. I'm going on 2 years since taking it. Best 2 years of sleep I've had probably since high school. Um, but CBN, which actually, and I know I was talking before about the where different cannabinoids come. CBN actually is what happens when THC becomes stale, no longer has its intoxicating psychoactive property to it. It then becomes CBN, which can be great for sleep. And typically in anywhere from 5 to 40 milligrams, and gradually worked up. A lot of people will take CBG. I didn't mean to say that. Will take CBD and CBN together. CBN and THC also does seem to be a really spectacular combination for people who are having sleep issues. Okay, next question. I am seeing more pediatric monkey cases being reported in the news. Is monkeypox starting to spread more rapidly among children? The answer is no. It is not rapidly spreading among children. There are cases. Now, first of all, spreading among children to me would be thinking about an infectious disease that's being passed from child to child, the way that chickenpox or COVID or the flu or name your virus du jour. Monkeypox is not being spread from child to child. Monkeypox cases seem to be from an adult who has monkeypox, and more from cuddling, very close contact, um, potentially sharing beds together, sharing contaminated towels and sheets, that type of thing. So there have been a few cases. So we had originally heard about the original two. I believe they were in California. There has more recently been another case in New York. There was a case that in the past couple weeks popped up um, in North Carolina. There has been three recently reported cases in Georgia. Now, not all of these have they determined or at least announced where it came from, but we're talking about less than 10 cases nationwide right now. Now, of course, no way we're going to be able to predict where this is going to go. But I certainly can't say 10 cases nationwide would be a rapidly spreading thing. Keep our eye out for it. But because this is not primarily spread through more general aerosols, it may be spread, and there may be some in within respiratory droplets, and so in that face-to-face close-up, maybe passing it along. But it really is going to be more so, coming back to what kind of things that we learned about proper hand washing, looking at our bodies, or having somebody in our family make sure we don't have any lesions. That would be something that would be helpful too. So keep our eye on it. Coming back to the, hey, if you have a concern about this or any virus, make sure you have good vitamin D and zinc levels, and remembering that monkeypox starts off with more of a flu-like illness, similar to chickenpox, and starting the immune protocols at that point, not waiting. If you do nothing before the pox show up, you've wasted time because you could have treated with the more general immune support protocol to start out with. Okay, so yeah, is it scary? Yeah. Is it deadly? No. That's good, right? Not really any cases of that we're seeing in terms of that happening. There have been sporadic cases, but we really aren't hearing of people doing it. But it is a painful condition, and it can last for weeks, and certainly something that we wouldn't want to have anybody blessed with. That's for sure. Okay, next question. I, pardon me. Okay, here we go. Sorry about that. I looked at the wrong place. I am wondering if my child might be being bullied. What signs should I look for? Okay. Sad topic. Okay. And this is something that does kind of come up for every now and then in our practice, especially during the beginning of the school year. Kids come back, new kids are there, kid dynamics are changed. We know that bullies themselves are often bullied themselves, unfortunately. And there could, of course, be bullying even from a parent or something at home. Now, if we're talking about a teenager, of course, some of these things I'm going to say could also be just because your kid's a teenager and they change in their moods. But in general, a change in a child would be of whether it is with their appetite. Are they becoming restricted, not wanting to eat? That would be a concern. Are they having sleep difficulties, especially maybe it seems like anxiety based? Are they becoming withdrawn? Are they not wanting to participate in family or friend activities? Are they kind of like hanging out more by themselves? Are they frankly showing other signs of depression, being sad, withdrawn? Of course, they may talk about it as well. But not all kids do. And of course, there's this concern if I tell them that it's going to make it worse. Now, granted, all schools are supposed to be bully free zones and are supposed to have programming and instruction and guidance counseling dealing with this, but we know that it happens, and it is more commonly happening in middle schools, unfortunately. But you want to kind of look to see if your kid is showing any of those symptoms. Are they talking about their friends? You know, if you have a close relationship with one of their friends who's around, you can, hey, are you noticing anything different at school? Oh, lowering of grades. Forgot to mention that. That would certainly, if a kid who is a higher performing student is all of a sudden drop not doing theirs, you're getting messages from the teacher that they're not doing their work. They may not be paying attention, showing signs of ADD. Well, if you're worried about something, you're not going to focus on something else. So that would, of course, be something to be looking for. It is so sad when I hear about these things, and I do. And unfortunately, some of our kids in our special needs populations, autism, it can happen to them, which is, of course, just not that it's good for anybody, but God, you're talking about breaking one's heart to have a special needs individual being bullied because they have special needs. It's just terrible. Um, but um, yeah, so obviously those are the things to look for. But of course, it should be dealt with aggressively. It should be brought up to administration, guidance counselors. Things need to be said. And of course, if your kid is complaining that somebody is being mean to them or somebody said something, they could be bullying in the LGBTQ plus community. There could be bullying based upon a person's skin color or their religion and of all those types of things. So, just really being on the lookout for what it is. You know, that's kind of where it would be. Okay. So we have time for a couple more questions. Next question. My daughter is a picky eater. What are some strategies for making sure she is getting proper nutrition? Well, the first thing that we should do in that situation is looking at the basic nutrients. Now, for an age, there is a certain amount of fluids that should be consumed, carbohydrates, proteins, fats, as well as, of course, vitamins, minerals, etc. So, working with a nutritionist, or at least keeping a 3-day food log to see what really is being consumed. I have seen kids who have restricted their diets, but the foods that they are doing hit all of the major food groups up, and at least I know that they are getting what they need. If I'm concerned, maybe give them a nice multivitamin, etc. But that's really the first place to start: is are they being deprived of a nutrient? Because if it is, then that could be a particular nutrient food that you'd want to focus on over other things. Now, most kids in picky eating, and there wasn't a message as mentioned as to how old this child is. Super super common in toddlerhood. I think of it somewhat as a control thing. Part of toddlerhood, when they're establishing themselves and kind of seeing what they can manipulate and what they control, and what goes into their mouth as what comes out the back end are some of the few things that a kid that age actually has full control over. So that's where sometimes the stool withholding and the constipation can come in through the back end side of things. But certainly that's what I would want to do. Now, of course, when a picky eater could mean different things, though. And there's actually different things that I go looking at. Number one, could there be a medical issue? Could there be some type of oral lesion that we're not aware of? Could there be some type of reflux, some type of hiatal hernia, ulcer, etc., that may make them not want to eat very much at all? right? That if there's something going on there. Could they be constipated? I have seen kids who are constipated reduce their oral intake because things are backed up pressure here and they kind of just instinctively know, well, I don't want to put more down there if it ain't coming out the back end. So that's one of the things. Is there a medical issue? Second question, is it a behavioral issue? And that's more that control thing that I was talking about. And then in those situations, different strategies would be employed. Offering them two choices, but that's their choice. You can have this or you can have that. If your kid's not eating green vegetables and you say, well, do you want broccoli today or do you want green beans today? You don't care probably if your kid has broccoli or green beans. You just want to have it. But by giving them a choice, it gives them some level of control. Now, if they choose it or they don't, another way of doing it is this is your food. Do you want it now or later? The one thing do not do though is don't give your kid a junk food. Do not give your kid a snack because they're not eating because it's a preferred food because it teaches them, hey, if I hold out, I'm going to get that. Okay. Now, the third thing that can sometimes be happening is it could be a sensory issue as well. Some kids just don't do well with certain textures. Some people don't even kids don't even like the feeling of certain things on their hands. Their oral, they can have oral texture issues as well. There could be a taste issue. There could be a temperature issue as well. So that's some of the things. So you really want to first kind of break it down and to see if you can figure out where it is. But other things that we could be doing. Hopefully, we are all eating meal times together, especially dinner. So at the dinner table, we can talk about food, how delicious our food is. Maybe even like say, "Oh, this is make it over dramatic. This is the most delicious piece of carrot I've ever tasted in my life. Would you like some, honey? No, okay, fine, more for me." Maybe even sharing with another adult or another kid. Hey, honey, check out how wonderful this carrot tastes. Here, oh, isn't that just the most wonderful carrot? Yes, great. Hey, would you like some? No? Hey, you know what? Why don't I put it here on your plate? If you want it, it's there for you. If not, that's okay. We can always try later. Don't pressure the kid. Pressure can push back, force opposite of the direction. We don't want them to push back further on us. But again, the most important thing is are they getting their basic nutritional needs met? And if the answer is yet, we don't have nearly the level of concern, and most often they will outgrow it. Okay. Now, before our final question, I do want to always put our plug out. If you haven't subscribed to our channel, please do so. Please share this information with others. Hit the notification button if you want to be known. If you want to be known whenever I do post something to our YouTube channel, sign up for our newsletter. We put out a monthly newsletter as well. We always put little tips in there as well. And again, I mentioned our Patreon page where we put special content in there, more proprietary things, so kind of like inside the scenes types of things, special protocols, etc. So if you want to get an even broader sense and you're not a member of our practice, that's a good place to get some of the deeper information as well. Okay, now for our final question of the day. Do you have any comments about the updated COVID vaccines? Update. Okay, so it's interesting. Okay, so as you may know, that both Pfizer and Moderna have reformulated. They're calling it a bivalent because there's now two antigens as opposed to just the original making of the spike protein from the original strain that was great for the Delta in terms of the coverage. But of course, as we know, when it got to the Omicron phase, that the vaccines weren't working very well. It was preventing people from getting super sick for the most part, but wasn't stop people getting sick and passing it along. So what they've done here is they have reformulated it specifically to be making the spike protein that is in BA4 and more importantly BA5. So now as of this point, and you never know when this will change, there has not been another variant. And so we've been about 3 to 4 months. Now, usually it takes about 3 to 4 months to see another variant, but we haven't really seen any what we call variants of concern start to emerge anywhere that haven't just fizzled. So, of course, there is a good question to be had. How many people have had Omicron this summer, right? Have had COVID this summer? Because, of course, if you did, you almost certainly had BA4 or more likely BA5. And of course, that would bring into question, do I need to be vaccinated for BA4 or BA5 if I had it recently? And of course, the other side of that coin, though, is you don't know for sure. Now, if it was probably by late July, it was almost certainly, it was like 98%, I think, was as BA5. But if you had it maybe in June or May, you don't really know. So of course we don't know. Now, you could also say, hey, I did have COVID back then, and it wasn't rough for me, and I know must have antibodies and protection because I've recently had it. How relevant is it to that person? That's a fair question, right? But in terms of what they're doing, it certainly does make sense that if they're going to continue the vaccine um, protocols, if they're going to continue using this as a line of defense, and of course, if people are going to be taking it, you sure would want to make sure that you're getting one that's at least protecting as to what the virus is that's out there right now. So certainly, I have no qualms if a person chooses that they want to do this. And they say, my doctor told me I should go get the COVID vaccine now because it's been 4 months since my last one, and now I should do it. Why would you do it now as opposed to waiting a few more weeks and getting the real protection that's out there? I saw a news article today that they are thinking the week of Labor Day maybe when they're starting to release this. So if that is your desire to do, there is some added help on the horizon. Certainly, I haven't seen any data yet. We've seen press releases. And as you know, press releases don't give nearly the amount of information. And as you know, and this was a problem from the very beginning back 2 years ago when the first vaccines came out. And if you followed when I was making my presentations to the FDA about my concerns about vaccines and the research and what they were doing, you know that I couldn't they would give a press release and not give the full information, and I was having to make my presentations based upon a press release, and then maybe would only have 24 hours before the data came in after I submitted my slides. So I will certainly reserve judgment as until I can actually see data, because this isn't just about boosting antibodies. 90 or plus percent of all people in America now have some form of antibodies against COVID, whether it was from wild disease or from the vaccine. Okay. So I don't really want to know as much about, how are your antibody levels? What I want to know is it protecting people from getting hospitalized and dying? Right? Is it getting, or from people getting it and passing it along to a high risk person where that may be an issue? But I think it is way too early for anybody to be able to come out with a blanket statement as to how good or bad this may be. I'm going to withhold judgment. But if you ask me, do I suspect that this will bring a significant improvement in immunity over the previous version of the vaccines? That based upon where we are now in the end of summer of 2022, I do believe that there will be a benefit from that. Oh, now we just actually got another question coming in, and it's a bit timely, so I am going to rescind my statement that that was the last question, and this will probably be the last question now, unless somebody throws something else at me real quick. Okay, our son recently got COVID. We are following the protocol, but I was wondering, should I be giving vitamin D? Okay, well, God willing, you've been giving vitamin D already. Now, the thing about vitamin, and of course, there's never too early for a person to stop. And it has been known when I did it to give a higher dose, like maybe 2 to 3 times of the dose that I would normally give somebody for 1 week only, in order to kind of boost the levels up sooner. Okay, but certainly, I mean, again, we should all be taking it as well. Our the protocol that we've shared also that's now does sit on our Patreon site does talk about the various approaches to treating COVID, because we've talked about the preventive phase, the early phase, and then if you're going into the more that chronic or hyperinflammatory stage, and there are different treatment regimens that we use depending on where you're at. So I don't know where this is at, but certainly, keeping inflammation under control. But again, we're now in a stage with school that virus du jour is happening. There's all these viruses that have been dormant that nobody had, that there is not herd immunity to because people haven't been spreading it the last couple of years, that are coming around the schools now too. So of course, being on vitamin D, if not for this particular COVID infection, would be important for the school year, especially over the next month as more germs are being spread. That, of course, would be a great idea. Okay, so there we go. We are just at an hour. So hopefully you learned a thing or two, and I hope to see you back next time. Have a great day.